So today's topic is respiratory infections. These topics that we do on Wednesdays are not from your textbook. Okay, it is just to add more knowledge into your portfolio. Okay, to make you understand the concepts of certain medical terminologies used, anatomy and physiology, what is normal, what is abnormal, specifically to the students who are not from a science background or a medical background. These classes would be an aid for you to understand the world of healthcare. Okay, is it clear to all? These topics are not from textbook. Content of these slides are also not from textbook. It is just for your additional knowledge. Okay. So coming to respiratory infections, we'll go through some more or less common respiratory disease conditions, infectious ones, okay, and how nutrition impacts this infection. So what is a respiratory infection? It affects your respiratory system, the part of the body that is responsible for breathing, okay. These infections can affect your sinuses. Sinuses you can see here in this image, these yellow parts, okay, yellow parts of the skull which are empty. Sinuses should be filled with air. Sinuses are hollow parts in your skull, okay, and because of this empty hollow parts, you don't feel the weight of your skull, okay. You don't feel the weight of your head, you don't feel the weight of your skull. But when during an infection, when the sinusitis kind of condition, when the sinuses get filled up with fluid, okay, when you have a running nose, when you are undergoing cold or flu, you can feel the weight of your head because the sinus is filled with fluid, okay. Your head feels heavy, okay, it feels discomforting. So it can affect the sinuses as well, your throat, lungs, airway. And there are basically two types of respiratory infections: upper respiratory infection and lower respiratory infection. In the image, you can see your nasal cavity. When you look up through the nostrils, whatever you see, okay, and far beyond it also, that becomes the nasal cavity. Then your pharynx, you open your mouth, the end of the mouth that you see, okay, that is the pharynx, and below that you have larynx, okay. This nasal cavity, pharynx, and up to the larynx you have the upper respiratory infection, okay. Trachea, bronchi, and lungs, they make the lower respiratory infections, okay. They are the lower respiratory tract. What is an upper respiratory infection? Any infection that affects your sinuses, your throat. Okay. For example, common cold, epiglottitis. Epiglot is kind of a leaf, kind of a cover that covers your larynx. Okay. And because of the epiglot, when you eat something, okay, when you eat something, it does not go into your trachea, because when you're swallowing, because of the swallowing mechanism, epiglot is a kind of a tissue that will cover your larynx, so nothing goes into your trachea, okay. If it undergoes this piece of tissue if it undergoes inflammation, we call it epiglottitis. Laryngitis, when the larynx is your sound box. It's because of the larynx you have speech. Okay. So when larynx undergoes inflammation, it is laryngitis. When pharynx undergoes inflammation, that is sore throat. Very common when you're getting common cold, when you fall sick. Okay. When you swallow, you feel some difficulty in your throat. Okay, just above your neck, where your jaw ends and the extreme up part of your neck. Okay, that is where your pharynx is. Okay, that is pharyngitis. Then you have sinusitis, sinus infection. Okay, so these are the examples of some upper respiratory tract infections. Lower respiratory tract infection, it affects the airways, lungs. Okay, they last longer because whatever affects your lungs and bronchi or airways, if mucus is produced, it has to defy gravity, and it has to travel upwards, and in form of sputum it has to come out of your mouth, or it has to come out of your nose. Okay, so it takes longer time to recover from lower respiratory tract infection. When you get a common cold, okay, common cold, in 2 days or 3 days you're completely fine. Just 1 day or 2 day you will have that severe symptoms. Within 2 days you will be fine. It is very easy. But if you get pneumonia, okay, bronchitis, pneumonia, chest infection, it can take more than 1 week to recover from it. Okay, so they last longer. Like bronchitis, you see the small branches and this bronchi, these two different branches. When any inflammation happens here in these branches, it is called bronchitis. Bronchiolitis. Bronchioles are these small tiny branches. Is it visible on screen to all? Is it visible to all? The small tiny branches, small networks you see. These are the bronchioles. Okay, when these bronchioles undergo inflammation, it is called bronchiolitis. Chest infection in any part of the lungs, okay, lower lobe, upper lobe, anterior, posterior lobe, okay, any part of the lung undergoes infection. So that is called chest infection. You inhale bacteria or virus, and they spread infection. Pneumonia, what is pneumonia? If any foreign matter you have exhaled, it gets stuck in your lungs, that causes pneumonia. Okay. 1 minute. Lower respiratory infection is done. What causes upper respiratory infection? When you get an upper respiratory infection, when a virus or a bacteria enters your respiratory system, it could be fungi as well, any encapsules as well, dust also could lead to infection. Okay. For example, if you touch an infected surface or shake hands with a person who is sick, and then you touch yourself, you wipe your nose, you wipe your mouth, okay, you scratch your eyes, these germs on your hands can enter your body through these portals and it can infect your body. Usually that is how upper respiratory tract infections spread. Okay. So causes viral infection, bacterial, okay. COVID was a viral infection. It's an upper respiratory tract infection. And you have bacterial infections, fungal, allergies, nasal polyps or tumors, deviated nasal septum. This is deviated nasal septum means when you touch the bridge of your nose and try to gently uh, push your tip of the nose. Okay. And if you have a deviated nasal septum, the nose bridge will either go to the left or right. It means you have a deviated nasal septum. But when you're pushing the tip of your nose, nasal septum is also bending down without deviating to either of the side. It means you'd have a non-deviated nasal septum. With deviated nasal septum, usually you will find it difficult in breathing, so especially when you sleep at night. Okay. And it's very common. Who is at risk of upper respiratory infection? These infections are common. Anyone at any age can get it. Okay, yet there are certain groups of people who are at more risk than in catching these infections. Children, okay, elderly people, children, pregnant women, people who already have a weak immune system. Okay, so these are the groups of people. Am I audible to all? Is there any other disturbances in between? Okay. So children are at high risk since they are often with other children who can carry, maybe carrying a virus, and they are not also, they also don't know things about it. Okay. Children play with each other. They are unaware that who is sick, who is not sick. They don't understand the concept of falling sick because their friend is sick. They don't understand these concepts. Okay. And children also who don't wash their hands before food, after food. Okay, usually children wash their hands less frequently than adults. Okay, people who have lung or heart problems from past history, and those who have a weak immune system because of other disease, because maybe it's because of typhoid, okay, or any infectious disease a person is undergoing, like TB, AIDS, okay, any infectious disease a person is undergoing, their immunity is down, and it is very easy for them to catch some other disease condition also. How are upper respiratory tract infections diagnosed? Okay, how will you come to know? Your healthcare practitioner or doctor will do a physical examination and check their symptoms. They will have a look into your nose, ears, and throat. A scopy is done. They are using a stethoscope. They will examine your breathing pattern. If any mucus is developed inside your lungs, okay, a regurgitation kind of a sound can be heard in the stethoscope. That is more than enough to conclude that if a cough is present or not, if you are suffering from an infection or not. Okay, very rarely you will need other tests, but if even if at all other tests are being prescribed to you, okay, it could be a chest X-ray to see if it is tuberculosis, or to see the extent of mucus or cough generation that has taken place in your lungs. Lung CT scan can be done to see any blockages, any if it is a tumor or a cancer, how far it has spread. LFT, lung or PFT, pulmonary function test, is to see how well your lungs are working. Okay, people who have asthma, people who have bronchitis, okay, for them pulmonary function test is done to see how the capacity of the lungs, okay, the breathing capacity of the lungs. Nasal swabs are done to rule out any infection. Throat swab also is done. Microbiological examination will be done. Microbiological screening will be done in nasal swab and throat swab. Sputum test is done if you doubt there is a TB, or you doubt there is an infection. Okay, in that situation, sputum test can be done. You cough off some sputum, you collect it in a sterile jar, and then you submit it to the laboratory. Then upper respiratory infections are contagious. Okay, usually the flus and all that comes under the flu category. Common cold. Okay, these topics don't have page number. This is not from the textbook, as I mentioned earlier. Upper respiratory infections are contagious. They pass from one person to another person through respiratory droplets or hand-to-hand contact. And people who have the upper respiratory infection can pass it to others also. Through this is airway and droplet kind of a transmission when you sneeze or cough without covering your nose and mouth. Okay, you are spraying germs into the air, infectious germs into the air, and any person who is very closely standing next to you or sitting next to you within 20 feet of you, they are exposed to this germ filled droplets. Sneezing or coughing into your hand and then touching anyone else, okay, without washing the hand when you go and touch somebody else, that also leads to infection. And what are the symptoms of upper respiratory infections? Fever will always be there. When there is a fever, understand an infection is there. Okay. Whenever the body temperature rises, it's an inflammation, sign of inflammation or infection. So cough, fever, hoarse voice, your voice becomes very rough and it sounds different also. People will ask you, what happened? Are you sick? Okay. Fatigue, lack of energy, red eyes, runny nose, sore throat. And when you touch the lymph nodes near your neck, okay, at the below your jaw, when you touch the lymph nodes, it feels swollen. Okay, and when you swallow, there is a swollen difficulty as well. Swelling on the sides of your neck when you palpate, you will find swollen lymph nodes. So these are the symptoms of upper respiratory tract infection. How long an upper respiratory tract infection lasts? For 1 or 2 weeks. Most of the time they can go away on their own. If it is common cold and all, within 2 days it will go away. Disease sections will not be asked in examination. This is just for your knowledge. Over-the-counter pain medications can also give you some relief, like cetirizine and all. Okay, drink a lot of water, lot of vitamin C rich fruit juices. And if your symptoms are not going away, even if after 2 weeks, your symptoms are still persistent, okay, then you have to go visit a healthcare provider and get some tests done. Okay, it could be pneumonia or bronchitis as well. Can antibiotics treat upper respiratory infection? Most of the time, virus are the causative agent of respiratory infection. Do you think antibiotics will work on viruses? Can antibiotics kill viruses? What do you think? Can antibiotics kill viruses? It will not. Antibiotics are exclusively for bacterial infections. Antivirals are prescribed for viral infections. Antifungal are prescribed for fungal infections. Okay. So viruses do not respond to antibiotics. Okay. Just through pain relievers or some antivirals and proper rest and being hydrated, this is more than enough to recover. Okay. And if you have a bacterial infection like sore throat or strep throat, streptococcal infection in your throat, okay, streptococcus is a bacteria. Streptococcus is a bacteria. So strep throat means streptococcus has caused infection in your throat. Very common. Okay. In this, antibiotics like penicillin or amoxicillin are frequently prescribed and it works. Then antibiotics should not be prescribed for common cold. Common cold is caused by a virus. Sardi Zukam, what we say in Hindi. Okay, that is common cold. It is caused by a virus called rhinovirus. Antibiotics will not work on it. It's a virus. It's a viral infection. And antibiotics should be considered only for specific secondary bacterial infections such as sinusitis, streptococcal infections, pharyngitis, otitis media. Otitis media also take a ear swab and see if it is a bacterial infection. Okay. And even in bronchitis, cough up the sputum, check the sputum, do microbiological screening of the sputum to identify the causative agent. If it is a bacteria, then prescribe antibiotics. This prescription is done by doctors. And unnecessarily, if we prescribe antibiotics when there is no requirement of antibiotics, you're still giving antibiotics to the patients, or patients are still entertaining antibiotics, that could lead to antibiotic resistance. What happens is that today penicillin may work for you, unnecessarily you had penicillin, okay, it may give you relief from the symptoms, but tomorrow again if you have the same condition, penicillin will not work. Your bacteria, the infected bacteria has learned how to overcome penicillin. That is antibiotic resistance. And if you have any of the following symptoms, you have to immediately seek your doctor's help. If there is a loss of consciousness because of breathlessness or lung infection, high fever, more than 103 degrees Fahrenheit, rapid breathing, difficulty in breathing, frequent coughing, severe coughing. Okay, in some cases, severe coughing that leads to blood in vomit. Okay, hyperemesis, that is too much of vomiting. And then wheezing. Wheezing is, if you must have seen asthma patients when they are under an asthma attack. Okay, when they try to breathe air, there is a specific whistling sound that comes. Okay, when they are breathing in or exhaling, there is a specific whistling kind of a sound that comes. That is called wheezing. Okay, it's a high pitched whistling sound that is caused when you breathe. Dizziness depends upon your medications also. Some medications will lead to drowsiness, like cetirizine. Okay, if you have prescribed cetirizine, that could lead to dizziness. Then retraction. You will see, like when you are trying to breathe in, you are taking big inhale of air. Okay, your respiratory infection is so severe that you can see your rib cages. Okay, your rib cage can be counted. The number of ribs in your body can be counted by the action of breathing in. Okay, and this is more commonly obvious in children, not that common in adults. Then stridor, it's kind of a harsh, raspy, vibrating sound that you produce when you're breathing. It's not whistling sound. Okay, it's more a vibrating kind of a sound. And it is more common when a child is getting affected by common cold. Stridor is very common. If you are affected by dry cough, usually allergies, asthma, some dust that you have inhaled, bronchitis, any reflux syndromes. Okay, these all are the reasons of dry cough. Coming to the nutritional consideration, how nutritional management can be done here. Diet is a significant modulator of immunity. Okay, certain macro and micronutrients play important roles in immune function and have been demonstrated to alter both the risk of and upper respiratory tract infection and its duration. So just by diet itself, risk and duration can be, it does not give you a shield against infection. You may still get infected, but the severity of it could be reduced with proper diet. Zinc. So zinc supplements or multivitamins that have zinc is good. Zinc ions inhibit rhinovirus, which I mentioned. Rhinovirus is the causative agent for common cold, through several mechanisms. Either it will prevent the rhinovirus to cause its copies. When there is too many rhinovirus, okay, just one rhinovirus has entered your system, they start to multiply, and when there is too many rhinoviruses in your system, that leads to and in that situation, zinc can boost up the immunity to take care of the increase. Then lozenges, these are a different category of drugs which are used to reduce the duration of colds by nearly 3 days. So a regular person may suffer from the common cold 2 days before it actually hurts them, and 2 to 3 days after they have been hurt. Okay, so the duration of the time when the person is suffering, that could be reduced when they are on zinc supplements. Fatty acids, omega-3 fatty acid supplementation, which provides good dose of EPA and DHA. Okay, that also reduces incidence of upper respiratory tract infection as well, having good quality of omega-3 fatty acid on a daily basis. Then vitamin D supplement. So there has been some trials done on vitamin D, and it has been found out that vitamin D also has an ability to reduce the incidence of upper respiratory tract infections. Then vitamin C, we all know the importance of vitamin C when it comes to treating common cold or treating common infections. Okay, the most evidence, however, supports the efficacy of mega doses of upper respiratory mega doses means large doses. Okay, and these studies were done on individuals who are under significant physical and environmental stress. Okay, so or only on these people the vitamin C studies have been done. But in people who have a history of developing colds quicker as compared to the others with whom they are sharing a living space, okay, when they started to take vitamin C supplements, there was a 50% reduction in terms of how many what is the frequency of colds that they are getting. So that's all for the nutritional consideration for